Hey guys, welcome back to Barimelts channel. Today we're going to talk about how to get through an episode of dumping syndrome. So for those of you who do not know what dumping syndrome is, it is a side effect that can happen after weight loss surgery. It typically happens for people who have gastric bypass, but it does also happen for any weight loss surgery patient. I have experienced my fair share at dumping syndrome, and today I kind of wanted to just talk through what it is and how specifically you get through an episode, but to also be thinking about ways you can prevent dumping syndrome from happening. So dumping syndrome typically happens when you eat too much sugar after a meal. But it can also happen if you've eaten too much fat or if you haven't waited the 30 minutes to drink something after you eat your meal. There are multiple reasons why it happens, but when it happens, it really, really sucks. So today I want to talk about things you can do to get through an episode, because if you haven't experienced this yet, when you do experience it, it can be very overwhelming. It is very, very difficult, and it takes some time to kind of learn your body and learn what you need to do in that situation. So the first thing that I recommend, and again, try to remember that this is my own experience. So there are different people who have to do different things when they have dumping syndrome. Some things that I might mention might make things worse for other people. So you kind of just have to do a trial and error and figure out what works for you personally. But for me personally, what tends to work is to lay down. Now, some people, this makes it extremely worse, but for me, it makes things better. I have to lay down because I, especially at the beginning, would get so dizzy that I just couldn't see straight, so I had to lay down. Now, it's very uncomfortable at first, but after a few minutes, it starts getting better. And I remember I used to even have to like lay down, sit up, lay down, and just kind of keep that movement going because I had such bad anxiety from them. I have found too, just kind of like laying back, like reclining was kind of the best position for me. Not all the way flat, but not sitting all the way up as well. And finding that right position and just trying to breathe. Breathing helped me so much, just getting control. And I knew that I couldn't control everything my body was experiencing, but I knew I could control my breathing. So just taking in deep breaths and meditating and just saying, you're gonna get through this, it's okay. Like just doing that deep breathing is very, very helpful in those situations. Towards the beginning of my journey, this did not help, but as I've gotten further out, it does help me now, and that is drinking water. Usually when I was experiencing dumping syndrome in the beginning of my journey, nothing would help and I just had to wait it out. But now I have found that drinking water tends to just kind of make it go by a little bit faster for me. So if you're one who's a little farther out, or maybe even early on, you could try this and see if it helps. But just taking a couple sips of water usually calms me down a little bit and just makes it go by a lot faster. Another thing you can do is to distract yourself. It's gonna happen. It's going to have to just get through your body. You have consumed obviously way too much sugar than you should have taken in, or whatever it was that caused it to happen. And you just have to wait it out. So distracting yourself and finding something that will just keep your mind busy and let it pass can be really helpful. So maybe it's a game on your phone, maybe it's calling someone. Well, maybe not, because if you're like me, I get really snappy when I am having a episode of dumping syndrome. So maybe don't call people, but playing on your phone, you know, looking at Facebook, doing something to distract yourself. Maybe watching this video right now is getting you through an episode. Watch YouTube, watch a TED Talk, do something to just keep your mind busy. And if you're like me, it usually only lasts about 10 to 15 minutes. It doesn't last long. Some people do experience longer dumping episodes, but for the most part, it's pretty fast with how quickly it moves through your body. So find something to distract yourself so you can get through that time a lot faster. Now, some people experience diarrhea and vomiting from dumping syndrome. The things that happen to people from dumping syndrome are very, very different depending on what type of patient you talk to. For me personally, the things that would happen would be things like a fast heartbeat. I would start sweating. I would get really nauseous, but I wouldn't throw up. I'd just be really dizzy and just feel like I was spinning, and really just bad anxiety. The worst part of it all is the heart pounding. That was always the part that I hated the most, because it gives me such anxiety. When you can feel your heartbeat and when you can feel it like that, to me, it's just not right. It just doesn't make you feel good. So that's what happens to me. A lot of people, they do experience vomiting or diarrhea. I do have episodes of dumping now where it is diarrhea, but I think it's more from having my gallbladder removed and the symptoms and side effects that I have from not having a gallbladder. So it's sometimes hard for me to tell what surgery is causing which side effect. But for the most part, you know, it really just depends on the patient. You could experience completely different side effects and different things that happen to your body, you know, depending on who you are. So I say all that just to remind you that, you know, things like being close to a toilet, that could be very helpful. So you're not running up and down different stairs, or maybe you're out in public and, you know, you just need to find somewhere to sit where you're close to a bathroom. Take a few minutes and just try to relax. Like I said, the most helpful thing I can share with you is to do deep breathing. Because, you know, you could try different medications. You could try to take, maybe it's, you know, an anti-diarrhea, or maybe it's a, I don't know, anxiety medicine. I don't know what medicine for what symptom you might need, but just doing that deep breathing and truly trying to meditate through the episode, I think could be extremely, extremely valuable for you. So, and recognizing it and just acknowledging that this is what's happening, and being able to reflect and say, oh, it's probably because I just had, you know, cotton candy. I don't know why that was the first thing that came to my mind, but, you know, just being able to reflect and being able to say that this is happening as a result of this behavior, and hopefully making a mental note so you don't do it again. So let's talk about a couple things that you can do to prevent dumping syndrome. So the first thing is to just avoid high sugar foods. I remember one of the first times I had dumping syndrome, it was when I had a Dairy Queen, or no, it was a Baskin Robbins sundae, and it gave me the worst dumping syndrome I think I've ever had in my life. I felt like I was having a heart attack. I truly felt like I was dying. It causes such panic, and it causes such, I don't even know how to explain it. You'll just know. And some people ask me, like, how do you know if you're having dumping syndrome? You'll know, trust me. So, you know, avoiding those high sugar foods and just staying away from them, I mean, that's the number one thing that you can do to prevent these episodes from happening. But like I said, remember, sometimes dumping syndrome can still happen from other things. I've heard many people experiencing it from high fat foods, and, you know, just not waiting the amount of time between eating and drinking. Some people even experience it if they lay down too soon after they eat. So like I said, it sometimes just takes some time after your surgery to figure out what's going to cause it for you, foods to avoid, and what you need to do when you're experiencing it, because every patient is different. Adding high protein foods into your diet can also help preventing dumping syndrome from happening, and that's just going to make you feel better altogether. Protein is something that you need to take really seriously after weight loss surgery. So make sure you're adding that in, and you're not eating too many carbs and getting all that unnecessary sugar that you don't need. But above all else, just remember, it's normal. It's okay that you're experiencing it. I know it sucks. I know it's very, very stressful. It causes a lot of anxiety, but it will get better because you will get better. You will understand what you need to do. You will understand the foods you need to avoid, and you will get stronger on this journey. So if you're experiencing this and you are just so overwhelmed, I promise you, you are not alone, and it's going to get better. So just be tough and stay strong. You will get through it, but make sure you are really reflecting, and make sure that you're really acknowledging the things that you might be doing and the behaviors you might be doing that are contributing to the dumping syndrome. But if you're watching this and you are having a dumping syndrome episode, take a deep breath, try to drink a couple sips of water and just do some meditating and really tell your body it's okay, you're gonna get through this. And I promise you, you will get through it. It's not gonna last long, and you will really start to learn your body as you get further along. So that's it for today's video. If you experience dumping syndrome and you have some more tips, please leave them down in the comments to give some other people some helpful tips and encouragement to get through dumping syndrome. I know this is a part of the surgery that we all hate, but it is a part of life. I am not looking forward to experiencing it again after my revision surgery to bypass, because I know it'll probably be different for me this time since it's a different procedure. So I would love to hear your tips, and I know other people would love to hear your tips as well. So please leave those down below in the comments. And as always, I love you guys so much. Please make sure you're subscribed and you like this video, and I will see you next time. Bye guys.